Parliament for Denison.
Deputy Speaker, last week the Royal Hobart Hospital lost its accreditation for psychiatric medical training. This is beyond embarrassing. It's a disaster. It's just days after 9 mental health patients were left stranded in the emergency department for an entire weekend because there were no spare beds. Clearly we need action now on mental health. It's ludicrous it only gets half the amount of funding to that for physical health. And that's just the start, Deputy Speaker. The Tasmanian government must give health reform a much higher priority. They say they have, but the evidence is they haven't. They simply must do this for Tasmanian patients and the long-suffering hospital staff who are sick and tired of plugging the gaps. Deputy Speaker, beyond this we need national reform, and in particular one level of government responsible for hospitals. But with both the state and feds involved, it's a complete circus, overly complicated and totally inefficient. And there must be greater investment in prevention. Currently, wellness programs only get 2 to 3% of the funding when we know every $1 spent on prevention returns $5 to the taxpayer. And there must also be greater focus on primary health care, with GPs receiving just 17% of the federal health budget, even though GPs see over 85% of Australians' population every year. Deputy Speaker, Tasmanians deserve a first-world health service, not the shambles we're lumped with.